I'm a plastic surgeon here at STARS Plastic Surgery, and I'm going to discuss a little bit about the candidacy for a breast augmentation on a patient, and whether it's just a breast augmentation that somebody needs or wants versus needing more than just an augmentation, meaning they need a lift instead of just a breast augmentation. So just about anyone is a candidate for a breast augmentation if they want a little bit larger breast than what they have. I personally go through a fairly specific selection system for what kind of an implant to place, what size implant, based on dimensions of the woman's breast. Sometimes the breast implant alone is enough to raise the position of the breast in such a way that no additional lifting of the breast is necessary. We tend to say that an implant will lift you one grade of ptosis. There are 4 grades of breast ptosis when it comes to how the breast hangs on the chest. And so depending on how low that breast is hanging on the chest may dictate whether just the implant will work or if additional incisions need to be made to raise the breast into a higher position. So those determinations, most women kind of know their breast and how things used to be, where they would like them, what kind of a volume they want. And I go through that discussion with the patients to make sure that I'm catering as much as I can to the patient's desire. The super majority of implants that get placed are under the muscle. It has a decreased incidence of what we call capsular contracture, and that's the implant covering becoming hard around the implant. I do tell patients that about 25% of women will have something else done with their breast. That's either because they've developed a capsular contracture, the implant's too high or it's too low, or they wanted a larger implant, or there's a problem with the implant that needs to be replaced. So about 25% of all women will have something else done with the breast at some point in their lifetime. It used to be that patients were told that, after 10 years you should have your implants replaced. I don't tell my patients that. If the breast feels fine, it looks fine, and an MRI is done, and it shows an intact breast implant for a silicone breast implant, then there's no need to have additional surgery done. The majority of patients have silicone breast implants placed. They're a much more natural feel than a saline implant. And so for the most part, it's a very straightforward operation. I personally do a rib block with a long-acting anesthetic to give the patients a good 3 days of relief after the operation, because it's abnormal to have something under the breast muscle that wasn't there in the first place. So typically, as women start moving their arm and that muscle fires against an implant, it's an unusual sensation that the body has to get used to. And this kind of helps with that initial hump after the operation. So I hope this was somewhat helpful to hear a little bit about breast augmentations versus augmentation and lifts, and how I do things.